Hello, my name is Daniel Gunderson. My pronouns are he/him, and I'm your nursing student from Elmhurst University, and I will be providing your nurse slash doc help your nurse slash doctor provide your care today on our telehealth call here. May I please have your name and date of birth?
Joey Gunderson, 030402.
Perfect. And what pronouns would you prefer to be addressed by today?
He's him.
He, him?
Yeah.
Okay, perfect. And I see that you're accessing your telehealth online platform to screen to be a new patient prior to your office appointment. Is that correct?
Yeah. Yes.
Perfect. Well, then, throughout this little telehealth call here, then I am going to conduct a little interview on some documentation sheets that I have in front of me. And first, we're going to start off with the head, neck, thyroid, hemoto po poetic, and lymphatic history. We're gonna start off with, have you ever had any, um, do you have neck pain slash stiffness or decreased ROM?
No.
Do you have a history of thyroid disease?
No.
Do you have anemia?
No.
Uh, bruising or bleeding?
No.
Frequent infections?
No.
Enlarged or tender lymph nodes?
No.
Blood transfusion or adverse reactions?
No.
Exposure to toxic agents, chemicals, pesticides, radiation, or chemotherapy,
No.
exposure to blood-borne infections, hepatitis, or HIV,
No.
any others that I didn't describe that might be relevant.
No.
Okay. Next, we're going to go on to the history of eyes and vision. Um, First, I'm going to start. When's the last time you've had an eye exam?
2 years.
2 years ago?
Yeah.
And what were the results of that eye exam?
2020.
2020 vision. Perfect. Next we're going to get into vision symptoms. Do you have problems with near vision, reading, or close work?
No.
Problems with far vision or driving?
No.
Sitting close to TV, holding book close or far, squinting, tilting head, writing with head close to desk?
No.
Do you wear glasses?
No.
Do you wear contacts?
No.
Do you have trouble seeing at night?
No.
Do you have color vision?
No.
Do you have
Yeah.
diplopia, double vision?
No.
Any blind spots?
No.
Eye pain or headaches?
No.
Lid edema?
No.
Strabismus? Eyes
No.
not straight or wander?
No.
Redness, discharge, or itching?
No.
Excessive or insufficient tears, dry eyes?
No.
Photophobia, light hurts your eyes?
No.
Seeing floaters, flashes, or ghosting?
No.
Exposures to dust, fumes, particles, and machines?
No.
Participation in activities potentially hazardous to the eyes?
No.
Use of eye drops or other medications for the eye?
No.
History of eye injuries or foreign body in eye?
No.
History of eye infections?
No.
History of glaucoma, halos around light, loss of peripheral vision or glaucoma medications?
No.
History of cataract or cataract surgery.
No.
History of retinal disease, macular degeneration in older individuals, retinal detachment or retinopathy.
No.
History of diabetes, hypertension.
No.
History of eye surgery.
No.
Any others that I didn't describe?
No.
Okay. Next we're gonna get into the ears and hearing history. Um, any hearing loss or use of hearing aids?
No.
Uh, I'm gonna ask you to repeat these statements, and I want you to repeat them back to me. Oh wait, no. Do you ask for statements to be repeated or trouble understanding others or trouble talking or noise hearing in noisy environments?
No.
Earache, feeling of fullness or pressure, rubbing or pulling at ear.
No.
Discharge or drainage from the ear.
No.
Previous infections or perforated eardrums.
No.
Tinnitus, buzzing or ringing sounds, sloshing or crackling sensations in the ear.
No.
Excessive wax.
No.
Vertigo with or without nausea and vomiting.
No.
Prior ear surgery.
No.
Exposure to excessive noise, noise protection.
No.
Exposure to ototoxic medications, medications that may affect hearing or cause tinnitus.
No.
Any others that I didn't describe?
No.
Okay. Next, we're gonna get into the oral pharynx history. Um, Usual care of teeth and gums. What do you usually do?
Brush my teeth, floss.
Do you use mouthwash?
No.
Usual pattern of dental visits.
Um, like 2 or 3 times a year.
2 to 3 times. Next, we're gonna get into the oral pharynx symptoms, bleeding or swollen gums slash gum disease,
No.
pain slash soreness in tongue, mouth, throat, or teeth,
No.
halitosis, mouth odor, or bad breath,
No.
change in the color or consistency of the tongue or coated tongue,
No.
sore mouth, tongue, throat, or toothache,
No.
problems chewing,
No.
dry mouth,
No.
excessive saliva or drooling,
No.
dysphagia, difficulty swallowing or choking when swallowing,
No.
hoarseness or laryngitis,
No.
masses, ulcers, or sores that do not heal,
No.
white or red patches in the mouth,
No.
use of chewing tobacco or pipe,
No.
change in sense of taste,
No.
history of tonsillitis or strep throat,
No.
enlarged, red, or coated tonsils,
No.
teeth cavities, abscesses, or extractions,
No.
caps, bridges, or dentures,
No.
loose teeth,
No.
prior oral surgery.
No.
Okay, next we're gonna get into the nose and sinuses history. Um, we're gonna start off with any obstructions, stiffness, nasal congestion, or mouth breathing,
No.
nasal discharge,
No.
post nasal drip,
No.
Sinus pain or headaches,
No.
sinus infections,
No.
epistaxis, bloody nose,
No.
altered sense of smell,
No.
history of nasal trauma or fracture,
No.
history of nasal allergies, time of the year, allergen if known,
No.
any medications or nasal sprays for the nose or sinuses,
No.
and any other that I didn't describe here.
No.
Okay, perfect. And do you have any questions or concerns from
No.
today's telehealth call?
No.
Is there anything else I can assist you with or you need today before the end of our conversation and the doctor enters the conversation telehealth call?
No.
Okay, well, I'm about to leave the telehealth call and somebody else will be with you shortly. Thank you for your time today.
Yep.